Throughout a person's lifetime, blood pressure undergoes significant changes due to aging, physical development, and lifestyle modifications. For example, at birth, an infant's blood pressure is typically very low, around 60/40 mmHg. This low reading is due to the fact that the newborn's vascular system is not yet fully developed and the heart's pumping capacity is relatively weak. As the infant grows, the blood vessels gradually develop, allowing the heart to strengthen its pumping power, and blood pressure gradually increases. Then, by around age 2, during childhood, blood pressure stabilizes at around 90/60 mmHg. This blood pressure is also relatively low because children have smaller hearts with lower blood pumping capacity, and their blood vessels are more elastic with lower resistance. Therefore, children tend to have lower blood pressure. Next, as children enter puberty, during puberty, the body undergoes rapid growth and development. This is because during this stage, the secretion of growth hormones and sex hormones increases. These hormones promote rapid physical growth and development, but also directly affect the cardiovascular system. Additionally, during puberty, metabolic demands increase, and the cardiovascular system gradually matures, leading to a gradual rise in blood pressure. As age increases, by the age of 20 to 30, blood pressure typically stabilizes around 120/80 mmHg. At this stage, the body's physiological systems, including blood vessels and the heart, have fully developed and reached their optimal state. During the 20 to 30 age range, blood vessel elasticity is excellent, and the heart's pumping efficiency is very high, enabling most people to maintain normal blood pressure levels. Then, when entering the 30 to 40 age range, people in their 30s and 40s face many challenges, such as career development, work pressure, financial stress, family responsibilities, changes in self-perception, conflicts between reality and personal ideals, and a lack of motivation and passion, among other issues. Additionally, many people in this stage lack sufficient exercise, engage in overeating,
and then I just saw Kate 2.0 slipping away. And the shame would keep building, and I'd keep binging, and my entire life has been a cycle of just
consume excessive amounts of salt and fat in their diets, drink alcohol excessively, smoke, and stay up late. These unhealthy lifestyle habits or factors can cause blood pressure to begin rising, though it may not yet meet the criteria for hypertension. However, if left unaddressed, the risk of developing hypertension in the future will significantly increase. Then, by the age of 40 to 50, the elasticity of blood vessels gradually decreases, and the vessel walls begin to harden. Blood vessels are elastic, and the younger a person is, the better their vascular elasticity. However, as people age, vascular elasticity deteriorates. This is because with age, the elastic fibers and collagen in the vessel walls gradually decrease, causing the vessels to harden over time. This hardening reduces the blood vessel's ability to expand and contract. Due to the lack of elasticity, the heart exerts pressure directly on the blood vessel walls with each contraction, and the blood vessels cannot expand to alleviate this pressure. Therefore, under the same blood flow, hardened blood vessels must withstand greater pressure. Additionally, once blood vessels harden, the resistance to blood flow increases, forcing the heart to work harder to pump blood to all parts of the body. This can lead to high blood pressure.
How did he die? No one will tell me.
Well, as one ages, one's heart tends to enlarge slightly, and the artery walls and arterials become thicker, and then the elastic tissue within those walls and arterials is lost. So a condition that appears regularly in the elderly is something called isolated systolic hypertension. And
your pop was old.
By the time people reach 50 to 60 years old, the risk of hypertension significantly increases. This is especially true for those with a family history of hypertension, obesity, or an unhealthy diet. According to statistics, approximately more than half of the population begins to exhibit symptoms of hypertension during this age range. At this stage, hypertension is no longer an isolated issue, but a widespread health problem. Then, for those aged 60 and above, this stage marks the onset of old age, and blood pressure changes in the elderly are often more pronounced. As atherosclerosis worsens, vascular elasticity further decreases. Additionally, most elderly individuals have chronic diseases, reduced physical activity, and slowed metabolism, all of which contribute to a sustained rise in blood pressure.